In some other news, the cost of healthcare is something many people are paying close attention to. And while it seems to constantly be going up across the country, two well-known healthcare providers in the La Crosse area say they're finding ways to save patients money. News 8's Kyle Dimke joins us now to explain.
Well, Gunderson Health System recently expanded with the opening of its legacy building last year. Mayo Clinic Health System is sitting on a big chunk of land in Alaska that it's still finding a specific use for. Both healthcare providers are growing, but that doesn't mean your next checkup is going to cost more. Actually, it's quite the opposite. The goal of any healthcare provider is simple: keep people healthy. But the ways of doing that are changing.
We're all working very hard at improving our quality and lowering our cost.
It may sound tough to improve service and lower costs, but both hospitals in La Crosse say they're doing it by constantly looking for ways to become more efficient.
It's forcing us to find waste, eliminate waste, come up with better ways to take care of patients, rely on all of the Mayo knowledge and expertise to come up with best practices that maximize quality and safety.
We go into areas and we say, why are we doing what we're doing? We take the whole stream and write it out on a big piece of paper and say, well, this isn't necessary, and if we did this, we wouldn't have to do these three, and this is rework.
Both providers say the internet also helps bring savings to the patient, especially for those living in rural areas.
20 years ago, we built an electronic record. Most people in the country built them in the hospitals. We built them in our clinic to better take care of those patients so they didn't have to come to La Crosse. They could be taken care of closer to home. We know the closer to home we have that care for them, the more likely they're going to make use of it.
We don't have to reach patients with them traveling to a destination nearly as much as we have had to in the past. Using patient portals where patients can log on to their health record, communicate with their provider, ask questions, get refills.
Both hospitals say another way they're able to cut costs is by working together and educating the public. Over the past couple of years, both have put more emphasis on getting out into the community to try and prevent illnesses, decreasing the need to see a doctor.
Thanks a lot, Kyle. Both hospitals say having two large healthcare providers in the area is good for patients because it allows them to choose their providers. It also means constant pressure to improve in all areas of healthcare while keeping costs low.